Hello, welcome to today's video. So my name is Peter, and today's video is going to be on corticosteroids. It is quite a big topic, so we will be breaking it down into a couple of separate videos. But today we're going to be focusing on mineralocorticoids. So first of all, corticosteroids, also known as steroids, have anti-inflammatory properties used to treat a wide range of conditions. So they can be classified as either mineralocorticoid or glucocorticoid. So, in terms of medication, fludrocortisone has a very high mineralocorticoid activity with insignificant glucocorticoid action, and this is going to be the main drug that we discuss in this video. So, it's really important to note that there are other corticosteroids and they have different degrees of mineralocorticoid activity and glucocorticoid activity. So, especially in comparison with the endogenous hormone cortisol, which is shown in the table on screen now. So, let's get started on the mode of action. In the body, mineralocorticoids such as aldosterone act on the kidney where they cause sodium and water retention and active excretion of potassium and protons. The adrenal cortex releases steroid hormones, but dysregulation of hormones can cause disease. So, for example, Conn syndrome leads to an increase in aldosterone, primary Addison's disease. This is insufficiency of glucocorticoids and mineralocorticoids and androgens. So, secondary Addison's disease, which is insufficiency of glucocorticoids, but only glucocorticoids. So, what are the indication of steroids? So, in practice, fludrocortisone is actually used in combination with hydrocortisone in treatment of adrenocortical insufficiency, which is secondary to septic shock, for example. But it can also be used in primary adrenal insufficiency as well. It can also be used in neuropathic postural hypertension, although this is an unlicensed use of fludrocortisone. This is due to its ability to cause sodium and water retention to counteract the hypertension side effects. So, what side effects do we have for mineralocorticoids? So, we've got hypertension, which is to counteract the hypotension that we just discussed, and that's because of the sodium and water retention that we just mentioned before. It can also cause potassium loss, with symptoms such as fatigue, muscle spasm, muscle weakness, numbness, and palpitations, as well as calcium loss, which also can cause muscle spasm, numbness in hands and feet, especially around the mouth, and irregular heartbeat or bradycardia. So, side effects that are specific to fludrocortisone, though, are idiopathic intracranial hypertension, which is essentially high pressure around the brain, causing symptoms like vision changes and headaches. It can cause muscle weakness, conjunctivitis, and thrombophlebitis, which is just a blood clot in a superficial artery, usually in the legs. So, what severe interactions do we need to be aware of then? So, with steroids, there's an increased risk of hypokalemia, especially with amiodarone, citalopram, and macrolide antibiotics. So, for example, clarithromycin and erythromycin. It can increase the risk of gastrointestinal bleeds, especially when used in combination with NSAIDs or non-steroidal anti-inflammatory drugs. That's drugs like ibuprofen, diclofenac, for example. Um, the other thing is it can increase the risk of digitalis toxicity or digoxin toxicity. And it can also increase the risk of infection with live vaccines, so we need to be aware of that as well, particularly things like yellow fever. Okay. So, based on this, we're going to pop a question on screen now. This is going to be a typical pre-registration question, and it's going to be, which of the following is a severe interaction with fludrocortisone? Okay, so is it A, ibuprofen, B, cetirizine, C, allopurinol, D, diazepam, or E, sulfenacin? And if you want to have a go at this, you can pause the video here and have a little go. So if you said A, ibuprofen, you would be correct. And that is just because, as we mentioned before, ibuprofen, which is an NSAID or non-steroidal anti-inflammatory, can increase the risk of gastrointestinal bleeding. So just be aware of that. Alright, that's it for today's video. I hope you guys enjoyed, and I look forward to seeing you for part 2 of this video, which will be based on glucocorticoids. Thanks for watching. Bye.